Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docuseries.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Kick COVID-19 to the curb. The go-to guide for fortifying your immune system and winning this germ war. By Doctors Angela Akey and Kathleen O'Neill Smith, also known as the FIRRIMup Doctors.
Dr. Akey and Dr. O'Neill Smith have done an amazing job of explaining in simple terms how you can fortify your immune system in these COVID-19 times. Their description of the castle and how to fortify it, as well as the interconnectedness of everything, are just a few ways that their approach is truly unique. Filomena Trindade, medical doctor, master's in public health, certified by the American Board of Integrative Medicine, certified by the American Board of Family Medicine, certificate in functional medicine, fellow of the American Academy of Regenerative Medicine, author, teacher, and international speaker.
All right. Hi, everyone. We're so glad that you're joining us again this Friday, this beautiful Friday before the 4th of July. Hope everyone is being safe. Once again, this is our FIRRIMup Doctors webinar. Our email is firrimupdoctors@gmail.com, as well as our NFIM hotline that most of you know. That's NFIMGMV, as in Gators Make Victory, @gmail.com. During this webinar, if you have any questions, you can go ahead and send it in the chat, and we will try to answer it either through the chat or during our Q&A. If not, we will go ahead and get to it at another time. But for now, I'm going to let the doctors do the talking. So I'd like to welcome your FIRRIMup doctors, Dr. Angela Akey and Dr. Kathleen O'Neill Smith.
Hi, everybody. Hi, Dr. Kathleen. How are you?
Good. How are you doing? Thank you. Thank you, Emily.
Great job, Emily. So,
how is it in Florida? Yeah.
Yeah. So it's a holiday, and y'all are here. So thank you for coming to the FIRRIMup Doctors webinar. For those of you who have been in our practice, in my regional practice in North Florida Integrative Medicine, this is our 16th Friday. We have some neat announcements to make, but wow, we did it. We actually were trying to make it to July 4th unscathed with no one intubated and no one, not losing anybody, and we've done it. So it's a really happy day for us regionally here in Gainesville, Florida, Dr. Kathleen. How are you?
I can imagine. Yeah, I mean, it's amazing that you've made it this far. Now we have to keep going. We all have to keep going. It's really been quite a change. Mother Nature keeps handing us more and more and more challenges, but it's not like we can't take care of them.
Exactly. Next slide. Yeah, so we expect the skies to light up tomorrow with the 4th of July. Unfortunately, next slide. Unfortunately, we're also lighting up our map in the United States. At least here in Florida, we're doing a lot of testing, but I'll show you some data that looks like, next slide, that even though we have a lot of positives, our death rate is not going up. Actually, the case fatality rate is low, especially in Alachua County, but we're doing a lot of testing. And so what I think is happening is that we're mobilizing the green people, the people at low risk, and they're the ones that are getting it and being tested. And we've been messaging this for a long time now, that if you're at low risk and you're sick, or if you're out, you need to act as if you're carrying it and can give it to a senior person or someone at high risk or moderate risk, and just be really conscious about wearing your your facial coverings and washing your hands and doing the things we talked about. So this is US COVID-19 reported daily cases and deaths, a 7-day average from covidtracking.com. And we see all the way to the left, way back in early March. In the blue, you have reported cases per day, a 7-day average. And you can see how that was tracking up. And you remember in April, May, how we were really concerned about New York City, Boston, and then it starts going down. And then now it's starting to go up again. We have a lot more testing, but look at what's happening to the orange, which is reported deaths per day in a 7-day average. So again, it went up in April, May, and then it's actually, the death rate is actually sloping down. So that shows, to me, I'd interpret that as that we're having more testing. We're having the younger green people, meaning lower risk people, being tested because there's less death rates, because we haven't come up with a cure or a vaccine yet. Do you agree, Dr. Kathleen, or do you have a different spin on that?
Yeah, no, I definitely agree with that. I still think that there's so much confusing information out there because, again, the testing, we don't know if there's duplicate testing because people get many swabs, or if they're only using one person one time. There's a lot of things that we don't know about the numbers. I think it is important to remember that the numbers are going up and that there are possibilities of people who are vulnerable becoming very sick. That's the main thing to remember. It's really knowing which group, low, medium, high risk group you're in, and just always remembering that, and remembering that about the people that you love. I really think that no matter what you hear about, there still is no great data on any treatment. And I see some questions already that we will definitely answer with respect to. The studies are coming out so fast that we don't even know that we could trust them, because most studies take a long time to be completed, especially with treatments, with vaccines and things like that. So we have to be very careful at how we interpret the data. And any new data that comes out has to be thoroughly vetted, not just by a peer group of colleagues in medicine and research, but also by people who are on the front line. So it's really important to be thinking about that.
Just commenting on, or like being in medicine for 30 years, that I've never seen so many studies published and then retracted.
Exactly. I would say that a good 50% are not really even valid. More than 50, probably 50% are not valid because they're coming out really, really fast.
So let's go on to the updates in North Florida and in Boston. So let's start with the US. So 2.7 million confirmed cases, 33,000 tested, 129,000 deaths, 782,000 recovered. Here in Florida, we've tested over 2 million, 179,000 confirmed, hospitalized for 15,000 plus. Deaths were about 3,700. And considering we have a bunch of seniors, I don't think we're doing that badly, actually, because we have a lot of vulnerable elderly, especially in the assisted living communities, the nursing homes, and the seniors, the senior areas. In Alachua County, 1,423 are confirmed COVID positive, of which 7 are ours. 12 deaths, just 12 deaths. And in our practice at North Florida Integrated Medicine, 6,000 plus patients, of which 306 are high risk because they're chronic care management patients with 2 or more comorbid diseases. So at NFIM, we've done 101 serology tests. Only 3 have been positive, 2 IgG and 1 IgM. So that's how we're doing in Alachua County. So pretty good for Florida, and our seroprevalence in our own practice is actually lower than Alachua County. So people have been sheltering in and avoiding being sick.
They have been. I think that if they do continue to shelter in through this continued surge and wave that's, I think, happening, as I agree with you, mostly in the young people, they're getting tested more and more. I think it's important to remember that we don't have all the information. The virus will mutate because all viruses do mutate. And what we hope is that most viruses mutate towards a less infective form. So, and we have to observe, does it mutate towards a more infective form for elderly, for younger people? There's a lot of variables that have to be looked at. But I do agree. I mean, having any death is not good, but 3,700 deaths in Florida as a whole sounds small compared to 8,100 deaths in Massachusetts, which I know 75% of them were in nursing homes. So they were the elderly and the vulnerable for sure. So that's really important. And our numbers are going down. We're definitely opening. We're very stable on the trend of potentially going down. We had a really early large hit. So I think here we're opening up and I think we're in phase 3 starting on Monday of opening up, though for the 4th of July, all of the beaches will be closed and they're really discouraging people from going out and having a hoopla party. I know that there's some information that demonstrates that increased restaurant spending. So the more people go out and go into restaurants, outdoors and indoors, predicts new infections 2 to 3 weeks later. And that's looking at 30 million customers from credit cards who went out. So there's a very, very distinctive link between people charging their food at a restaurant and the numbers of people that are doing that and the numbers of positivity. Not necessarily deaths, of course, but wherever we have positive numbers, we know that the deaths will continue. And that's really the concern.
So why do you think that your nursing home deaths were so high? Did they not lock down early? Well, I mean, because I know that in Florida, they're still locked down. I'm taking care of 2 patients who are spouses of husbands that are in ALFs, assisted living, and they're so sad because they have to like communicate through a window. But I'm like, it's probably good to keep them safe for now.
So the initial cases, the first week of March in Boston, right? We were not prepared. So in March, nobody was prepared. But in Boston, actually in the western part of Massachusetts, remember, I think I mentioned this before, there were some people who we have no idea where they got it, were at a basketball game at the high school. And then that was transferred to a bunch of nursing homes out in the western part of the state. And there was a rampant spread. And so the problem too is that when people are in nursing homes, initially we didn't know that COVID was racing through them, and we send patients back and forth from nursing homes to the hospital when they have issues, right? So, I have a couple of patients whose family members were transferred to hospitals without knowing it, got sick, went back to the nursing home and died. So, yeah, so that was really, I think, what happened. It was really, we were blindsided by that and just this community spread where we never found out where it was coming from. And then the hospitalizations of the nursing home patients for usual reasons, urinary tract infections, you name it.
It's really, really tough on those in assisted living, the patients there who have mild dementia. They're actually spiraling down 3 months later because there's no activity and the family members aren't interacting with them. So it's a really tough situation. But looking at these numbers, I'm really supportive of that. I'm really happy that we haven't had as many deaths in nursing homes as you might think in Florida. So thank you for that. Next slide. So here's statistics in Alachua County. So this past week here, new hospitalizations over to your left were only 4 total. And we've done a lot of testing, almost 500 tests. There's been over 5,100 negative tests. And look at total cases and total hospitalizations, like 7%. And do you remember the Wuhan data way back in March? It was looking like 20% for hospitalizations. So that's not bad, 7%. And then over here, your case fatality rate in Alachua County is 0.8 to 1.1% this week. So about 1%, which is actually really good in my opinion.
It's a good number, but I think the thing that I would look at would be the total hospital cases, because if you look at the total hospital cases, you have to, I don't know how many beds there are in Alachua County. So that's a reason. You're doing a great job, but keep going, because if there's 96 people in the hospital, how many beds are there?
Right. So we're in the slow burn phase. And yes, and that's the whole reason why we can't have these, I saw in the news that in Tuscaloosa, University of Alabama, they heard that the college kids were having these COVID-19 parties and playing Russian roulette with who would get it first, and then they get the prize money. But really you can't, because we have to continue this social or physical distancing to make sure that we have a slow burn and not this overrun of our hospital system. That is a really great point.
Yeah, I think it's a good reason to continue to support your immune system, do everything you can, and try to not have to go to a hospital.
Yeah, so let's talk about food, because I last week started this sequence on mood, food, and the immune system. And I know how much, and I told everybody how much we love Italy and we love food. So this week I thought we'd continue on that theme. How do healthy fats affect the immune system? Next slide.
Food's going to be so important. I mean, if you can really think about the food going into your body, I always think like this. I think of my body as being alive, a living organism, a living thing. So living things need to use living food more. If you have a shelf life of a food that can, like a Twinkie, that can sit in your pantry for a long time, I always say the longer the shelf life of the product, the shorter the shelf life of the person. So I would really think that the short shelf life, refrigeratable, or things that are on your counter that you can eat, if you eat those 80% of the time, those are going to be living foods that are going to give your body, they're going to be life-giving to your body.
I like that. So the longer the shelf life, meaning preservatives and essentially foreign things to your body, it will shorten your lifespan. Correct. I like that. I've never heard you say that. Thank you.
Yeah, or probably more your health span. Like you won't be as healthy. It'll definitely be an issue. But this looks like an amazing party for the 4th of July right there.
I always say for our patients to shop in the farmers markets, the open markets if possible, but if not, if you're in the grocery store, stay on the outside where it's refrigerated. Because if you go on the inside of the grocery store, you get those preservatives, and the long shelf life foods are in the middle of the grocery store.
Oh, wait. So those 30 million credit card purchases that they looked at to do data dredging, they found that people who do their own shopping at supermarkets, the more we shop at supermarkets, which we were doing for a long time versus going out to eat before the phases of reopening began, the less COVID. So that's pretty interesting.
Wow. And they didn't divide it up into Whole Foods, because we have Whole Foods delivered to my house in Publix in North Central Florida.
No, they didn't do that data. No. But
I bet that's even less. So yeah, let's talk about the frequently asked question topic for this session. So omega-3 fatty acids are a type of polyunsaturated fat. Talking about food basics, and Dr. O'Neill Smith is an expert on food, so she can chime in. So, when I think of omega-3 fatty acids, I usually think of cold water fish, and the two subtypes are DHA, which primarily is for the brain, and EPA, primarily for the heart, but they cross. And if you are vegetarian, you get most of your omega-3 from ALA, but don't get confused with all of those terms. We're just going to talk in general about how to select food and why. But we're specifically talking about omega-3s in regards to the immune system, but they're so important for so many things, right, Dr. Kathleen?
I love omega-3s. I think that if you had to pick one of your top things, I like to target the particular patient and personalize it, but omega-3s are always on the list. Everybody needs them. Everybody can benefit. That EPA that's for your heart, that is an anti-inflammatory, but DHA is in baby's milk. So even if you were going to give your baby, you weren't going to nurse them, so we're going to give them, like, what do you call that when you don't nurse them? My two kids are older now. Oh gosh, formula. They would like DHA to be in formula. It's studied even in children because it helps them to develop their brains. So all of us have brains that need repair. All of our brains need repair. It's one of the nootropics, and fixing our brains and being sharp and staying on it is true for everybody, regardless of our age. We know the problem with ADD, ADHD, etc. Mood, depression, anxiety. Omega-3s, when I use them, even in any of those situations, anxiety, depression, cognition, they are always helpful. Always helpful.
And especially with traumatic brain injuries, because I know a lot of people on this call have children who might play sports or grandchildren. So head injuries, concussion, any of those accidents, fish oils can help actually heal, as well as calm down the brain and all those conditions that you mentioned.
They're so important. I mean, I think it's so interesting because I measure omega-3 levels like the DHA, the EPA in all of the patients. And I find that our children under 18 have really low levels. And it's kind of surprising. So if you have low levels of omega-3s, it must mean you have high levels of other things like omega-6s and trans fats and saturated fats. So really shifting that balance, or at least adding a supplement to help restore some balance, is really important. Historically, our ratio of these good fats, the omega-3, to the bad fats, the trans fats, the saturated fats, and some of the omega-6s that are inflammatory, like arachidonic acid, it was a 1-to-1 ratio. But now we have anywhere between a 25 and a 50-to-1 inflammatory fat to anti-inflammatory fat ratio. So we have 50 more times omega-6 inflammatory fats and saturated fats than we do omega-3s. So we really have to address that in order to have a healthy immune system, particularly in the brain and throughout the body, but certainly in the brain as well.
That's a great point. And I see some people on the call, so I recognize them. She's talking about when we measure, for example, through Quest labs in our population, something called an omega check. And I've taught you all that, for example, arachidonic acid is the inflammatory kind, and the EPA is anti-inflammatory, and EPA is a type of omega-3. So basically what she's saying is that the standard American diet, the McDonald's, fried, etc., gives you a 25-to-1 ratio. And that's way too high. In fact, we always like to talk about Dr. Camilo Ricordi's Poseidon trial, which said that you can reverse early type 1 diabetes, an autoimmune condition, if you drop that ratio down to closer to around 3. And not many Americans have that naturally, so you have to supplement. And I think, do you think the kids, they don't have much omega-3 because they're using it up, or they're just not eating omega-3 like the foods in this picture?
It's the food. I think it's the food. 100%. I think it's the food. I don't have any data on that, but I think it's the food. I think it's really hard to get kids to eat. And so we feel as parents often, I know I've been in this situation with 3 young children previously, basically we just want them to eat. And so we'll give them ultimately what they need, but we really should understand how important these healthy foods are. You know, one of the questions I saw in the chat had to do with bleeding time and how that's affected by COVID-3. Well, omega-3s appropriately allow blood flow. They don't really thin the blood, they allow for blood flow. So the issue is that a lot of people have said to me over the last decade, well, doctor, I take Coumadin, or I take Eliquis, or I take Plavix, or whatever blood thinner they take, so I can't take omega-3s. That's not true. You can reduce the dose of your medicine by taking something that's really good for you, that your body needs, that's part of building your body and restoring and regenerating your body when it has a need. So I think it's really important to understand that. You can always measure, it's called an INR, to see what your bleeding time is. But for COVID, the problem is with clotting. So omega-3s will be the opposite of clotting. They will allow for flow, so they will prevent clotting. But I wouldn't say that they would be the only thing. If you have a tendency towards clotting, you may need a med, but you also should take omega-3. They should not be just one or the other.
Yeah, so I did a consult on someone with a clotting tendency called factor V Leiden, and she wasn't on anything, so I put her on high dose omega-3. But should she get COVID, we would have to give her medication for blood thinning, for sure.
Yes. Mm-hmm. Mm-hmm. That sounds good. I mean, look at all these delicious foods. So I know I also have a lot of patients that um, are vegan or vegetarian and they don't want to eat fish. So what do we do in that situation?
Yeah, so in terms of the top 10 foods with the highest omega-3 fatty acids, you have basically, you're trying to get to 4,000 milligrams of omega-3. So you can look at flax seeds. So flax seeds for per ounce has 6,400 milligrams of omega-3 per ounce. So you see some seeds there, flax seeds. You've got, you could use chia seeds. I love my patients to be on chia seeds. That's the bottom left, those black things, those little black dots. They have 5,064 milligrams per ounce, about 2 tablespoons. So I love chia seeds in my steel cut oatmeal.
Or in shake or in your salad, or yeah, you can put them anywhere.
So you can, yes, and you can get them from the organic section of Publix. I also like putting chia seeds in almond milk overnight, and it makes a really nice pudding. So you can do flax seeds or chia seeds. Walnuts. Walnuts has 2,500 milligrams of omega-3 per ounce. So walnuts are a good source. You could do tofu, has 1,500 milligrams per cup of tofu. You could use navy beans. It has less, much less, 322 omega-3s per cup. You can use Brussels sprouts. It has about the same per cooked cup. And don't forget about the avocados. Avocados, I love avocados. They have good fats, and they actually have 223 milligrams of omega-3s. But think seeds and nuts if you want to go plant-based for your omega-3. But really cool, you know, a lot of our patients use salmon. So for 6-ounce fillet of salmon, you have 4,252 milligrams. So a 6-ounce fillet of salmon has a nice dose of omega-3. And don't forget, you want to get wild caught salmon. You don't want the farm raised dyed salmon.
And sardines, if you like sardines. I'm not a sardine lover, but sardines have a lot of omega-3 in them as well, if you like those. But there's a lot of plant sources that you can get omega-3s from with good amounts. You just have to kind of get creative about how you're going to use them.
Yeah, and you just remind me of a mnemonic I heard during one of the lectures. So the smash fish, they have a lot of omega-3s. So that would be salmon, mackerel, anchovies, sardines, and herring. So the smash fish when you're looking for fish. And, you know, on our website, we actually carry Vital Choice fish as well. That's my go-to. I know the fisherman who started Vital Choice, and I actually travel with his canned and packaged salmon because it tastes that good. So VITALCHOICE, but we have a link on our website as well. So you can get your omega-3 through fish-based or even shellfish, like oysters have 1,346 milligrams per 3-ounce serving. But if you don't want to go with fish and shellfish, you could go with tofu and the seeds and nuts, as well as the vegetables and the avocado we mentioned. So beautiful foods.
Yeah, if you eat, you know, from here alone, I mean, you might want this to be 25 to 35% of your diet minimum.
It's looking like the Mediterranean diet, super anti-inflammatory. Many of you have attended a group medical visit on immune fortification, and I showed you that slide about how our immune system ages past 40, and our smart or adaptive immune system, the specialized forces in our guidebook, go down after 40. So we end up being relatively inflammatory or innate. Well, this is a diet that's anti-inflammatory. And you all know that after 40, inflammatory states like arthritis and Parkinson's and Alzheimer's, those are inflammatory. So you definitely want to eat an anti-inflammatory diet. And omega-3s are anti-inflammatory. Next slide. So many of you on the call, you're scientists, I know, so I thought I'd throw this one in there. This is actually a slide from a paper published last year that said that the 3 types of omega-3, ALA, EPA, and DHA, actually affect your immune system army in a positive way. So remember you have the innate system that which we just talked about, tends to be inflammatory. It's the first line soldiers, the pawns in our chess analogy in our guidebook. And then you have the adaptive, the special forces, they need to be trained. And basically with the innate immune cells, it does everything right. So neutrophils are like the pawns, their first line. It actually helps them eat better. It helps them eat the invader better. The invader in this case is SARS-CoV-2, the virus that causes COVID-19 infection. So in terms of the Pac-Men, which we called the bishops, like macrophages and dendritic cells, it actually increases their ability to eat and actually relaxes them into the anti-inflammatory or the less inflammatory kind called the M2. For the omega-3s for the adaptive immune system, it calms things down. It increases T regulatory versus something called Th17. And then for B cells, it actually decreases the activation at the same time, increasing the antibody production, in this case, IgM. So for you scientists, you could pull that, the DOI is at the bottom, or the reference is at the bottom, it's on the web. So there is data that says that omega-3 fatty acids do things right in terms of our immune system. Remember that cytokine storm is the usual cause of demise, a complication of the COVID-19 infection, and that's an over-exuberant response of the immune system army. It looks like these omega-3s actually modulate them in the correct direction. Any comments on that, Dr. Kathleen?
There are, so, you know, even 10 years ago, there are stacks. You could put a ruler, 12 inches, and you've got stacks of papers that are done on omega-3s showing their benefits, not just in the immune system, but throughout the body, obviously, and in all of our cells. So I think it's really important to appreciate that. One of the big concerns is that you see at the top there where it says ALA, ALA is typically found in the vegetable and the seeds and the other sources. So the chia seeds, the flax seeds, the avocados and all those other sources. And the EPA and DHA are found in the fish. So if you are only going to eat vegetable sources, or if you're vegan and you don't eat fish, you should definitely check your EPA and DHA level, because the EPA and the DHA are really, really super important for regeneration. So not just for fighting and for, you know, affecting these innate and adaptive immune cells, but certainly for repairing. Well, first for preventing anything from being able to enter, and then secondarily for repair if something does enter. So ALA does not always go to EPA and DHA. It depends upon a lot of other nutrients in the system. You may need vitamin C and magnesium and some of the B vitamins and some other minerals in order to change the ALA from the nuts and seeds and vegan sources into the EPA and DHA. Fish goes directly to EPA and DHA and bypasses ALA. So that's really important to kind of understand when you're vegan or really not going to get any of your source from fish.
So summary is that if you want to go to the direct source, it's EPA, DHA. It takes a few enzymatic conversions from ALA to go to EPA and DHA.
Correct. Yeah, but I mean those foods are still beneficial. I mean they're so wonderful, and they're oily, and you know that those chia seeds will stick in your teeth and they'll stick to your hands, and they're so oily, they're wonderful.
Yeah, I forgot to mention, like with cell membranes, you want polyunsaturated fats because they're pliable, unlike the saturated fats, which are hard. So you want your cell membranes to be pliable and fluid. And that's what polyunsaturated fats actually do. You actually need fats for cell membranes. So it makes a lot of sense that, you know, the kids, when they have low omega-3 and low oils, that they could have ADHD, that they could have spectrum, or they could have trouble concentrating. So getting back to what you said, when you test levels, it's really a good maneuver if I get a new patient with ADHD to start high dose omega-3 and magnesium, and 9 times out of 10, I'm able to wean them off of their Ritalin or whatever they're on.
Yeah, it's true. I mean, every child with a brain issue needs a lot of omega-3. Food sources and likely supplementation as well.
Exactly. Next slide. Oh, good. Okay. Emily, do you want to pitch some questions?
Sure. All right. So Looking through the chat, I see one really good question that just came in, asking if hospitals will allow patients to bring their supplements with them if they get admitted.
So patient number 4 in our practice was and I actually have written consent from all the patients to talk about them as patient number 1, 2, 3, 4, 5. But anyway, patient number 4, frontline healthcare worker, presented to me on day 7 of his illness, got admitted with cytokine storm for 21 days. So during that time, because I was a previous hospital-based doctor at the private hospital, I was working with this hospitalist team, an infectious disease team, and telling them why I thought that he should continue his high-dose zinc, proline-rich peptide spray, and C. And so he did all that. But like what I couldn't do, which I was trying desperately to do by sending articles and podcasts, was convince him to do intravenous high-dose IV vitamin C when they wanted to intubate him in the ICU even prior. I couldn't get him to do it. I was trying really hard. I pulled all the references, but I just said it wasn't standard yet. And, I really looked at Professor Paul Merrick's work out of Eastern Virginia Medical School, because Paul Merrick is an intensivist who actually published in 2018 on a condition called sepsis in the ICU on using vitamin C high dose with thiamine, which is vitamin B1 IV, with good results. And so he extrapolated that to his COVID-19 cytokine storm protocol at Eastern Virginia Medical School. So I showed him all that data. I said, even in Seattle hospitals were using IV vitamin C, as well as University of Vermont, a doctor there was using it, but I couldn't convince him to use high dose IV vitamin C with IV thiamine. But I did, they were allowing him to use his oral supplements. So for my population, if you get admitted, I try to coordinate and at least use your oral supplementation. And when you come out, IV therapy, IV. I can do whatever we want. We can do whatever we want when you come out. Okay. Any comments on that, Dr. Kathleen up there? Did your patients, any of yours get admitted?
No, just the family members that were sent from the nursing homes. But here they would never let you. You'd have to put them in your drawer and take them when they weren't looking. They would never let you take your supplements. No way. No way. Nope, not happening under any circumstances. And you wouldn't even have a conversation about IV vitamin C. So that's why you don't go to the hospital. You just do your own IV vitamin C.
Which, and by the way, most COVID can be managed on telehealth. I mean, we've managed, thank God, tomorrow's July 4th, what I've called our Liberation Day for our population. Although, there's a slow burn in Gainesville, if you're red, high risk, please continue to shelter in, make appointments with me. I've talked to most of you. If you're intermediate risk, let's tailor a plan. But no, all but two people got admitted to the hospital in the past 4 months. So most can be managed on telehealth, and all of Dr. Kathleen's, she managed on telehealth.
Yep, they all did well.
All right. Another question I see in the chat. Someone said, I heard that the virus has mutated and is more contagious. Is this true?
Yeah, so there's a report last week that it came out of Scripps Clinic that basically that the strain, the S spike, the protein, there's over 25 proteins on this virus, but the S spike part that makes it the corona or the crown, that mutated. And they were reporting that it's 10 times more contagious than the original strain, but it's not any more deadly as far as they can tell. So as Dr. Kathleen told us in basic viral biology, the desire of the virus is to live. And the only way to live is to continue to evade our immune system. So in order for it to continue, it has to mutate, kind of like the flu virus mutates as well.
Yeah, we can expect it to mutate. So that's why everybody's looking for that. The question will be, what are the consequences of the mutation? And I think at this point, they're certainly not thinking that there's any more fatality or that any people get any sicker. I can't imagine that they could, because there's already some pretty severe illness that's resulting from what we have, but there's no evidence that it makes people sicker or sick in a different way, but it is thought to be more infectious. And apparently it won't really change the vaccine work that's going on in the research and R&D, because it's not that significant of a change. So this virus, apparently SARS-CoV-2, can actually if there is a change or a mutation and it's RNA, it can basically recorrect it. So it has good ways to go back and correct things, but this mutation is not significant enough to affect the vaccine if and when that does come around, apparently.
All right. A few questions from the past few weeks that are still left over. Someone asked if you had the opportunity to get tested, should you, even if you didn't experience symptoms or if you didn't feel like you ever had COVID?
I think it's a good question. It's kind of tricky because if you go and get tested and you're positive, remember with the nasal swab, that's evidence of the PCR. So the virus may have passed, but people may think you then need to go in quarantine. It's not necessarily true. It's hard to know where you are in the point of infectivity with a nasal swab because you need the whole virus, the entire thing, in order to infect somebody. So it's tricky, but you may end up quarantining, for 7 to 14 days once you test positive. So it's a tricky thing. What do you say about that, Dr. Ruthie?
Well, when I heard the question, I started thinking, are you wondering if you should check for RT-PCR COVID swabbing or antibody testing? Because I think those are two separate questions. If we're talking about RT-PCR testing, at least in our community here in Gainesville, no one's allowed to work on university without getting COVID swab tested. So they know who is coming in with infection. But Dr. O'Neill Smith brings up a good point that, remember, you can pick up positivity with dead bug, number one. And number two, even if you're acutely infected, it misses 30% of the time with RT-PCR testing. In terms of antibody testing, we're doing workplace safety masterclass courses now on the online. And so if you're talking about living or working intimately in a workplace, it would be nice to know if your team has antibodies, because it's looking like, although not definitive, the data is looking like if you have IgG antibodies, you're probably going to be immune. And so when we're doing those kinds of consults, it's nice to do everybody's antibody testing to know what you're dealing with in a community.
Well, and especially if someone has nasal swab testing, I think that you have to, and they're not symptomatic, you have to follow that up with antibody testing because you don't know the value. You don't know where you are in a time course. And by getting antibody testing, it gives you a sense of potential time course. There's no other way to find that out with RT-PCR testing, nasal swab testing. There's no other way to find that out.
Yeah, so you remember, and we even read it in the guidebook, that the studies are looking like the RT-PCR nasal swab testing could be positive up to 35 days out, but it could be dead bug. It could just be remnant RNA. And so I like what you just said, Dr. Kathleen, to check the antibodies so that you can get a snapshot of where they are in their exposure or their illness if they have symptoms. So if they're IgM, they're early to middle of their infection. If there's IgG only, then they've recovered, or do you agree with that approach, with that interpretation?
I don't think you can diagnose COVID an symptomatic or asymptomatic. I think all people who test positive or have symptoms and test negative all have to have more than one type of test. They all have to have a nasal swab and an antibody test.
Yes, and maybe even more than once, because to us, if it looks like a duck and sounds like a duck, it's a duck. If you have a viral illness, you've lost your taste and your smell, you've got this weird chest pain, you feel terrible. I don't care if the COVID swab's negative and the antibodies are negative, and you have a fever, I would still isolate you. I mean, it's around the community, and we go with our clinical suspicion, and like Dr. O'Neill Smith said, to go with different ways to test.
Hope that helps somebody.
Yes, that was an amazing.
I see a follow-up on the chat, so I'm going to jump in. Could you talk about which antibody test to get and where? Is giving blood a good option? Okay, so I could talk about Gainesville. So if you want to, you could donate blood and they will automatically check you for antibodies, mostly because they're still pooling serum for donation. Number one. Number two, we offer in our practice through your insurance Quest IgG antibody testing. But if you want IgG and IgM, we do blood spot testing outside of insurance on Friday mornings, and it does both IgG and IgM. And our test reports a 97% sensitivity and specificity if you're 10 days out from symptoms. What about you, Dr. Kathleen? How do you think about antibody testing?
I think that antibody testing, once you have symptoms, within 7 days, you can do testing for IgM. Within 14 days, you can do testing for IgG. And for the person who had COVID back in January, you should absolutely get an antibody test now. It's not too late. You want to know, do you have antibodies?
And you want
IgG.
to quantify it. You actually want to measure it. So we actually have the lab that you had recommended in Boston to actually quantify it and do it quarterly to see what's happening. Because this is like this particular infection we're actually studying in real time. But it makes sense, the approach that Dr. O'Neill Smith had recommended, that get a quantification of the antibodies.
Get the number. I'm glad you recovered. You all recovered. The people on the
Well,
chat.
unfortunately, I think that is all that we have time for today, since I have a few things to close out on. So I'm going to go ahead and thank you both for joining us, and I'm going to continue on.
Thank you, and happy 4th of July. Thank you for joining us and being on this journey, at least in North Central Florida, for 16 weeks. I'm really proud of all of us that we have gotten through unscathed. Praise be to God. And thank you, Dr. Kathleen, for joining us and being willing to continue with us.
Well, thank you guys. Happy 4th of July. Go Gators.
Thank you both. All right, so we have some new updates I'm going to go ahead and inform you guys on. We are now doing a July special. So for the whole month of July, if you purchase our Kick COVID-19 to the Curb guidebook, both paperback or ebook format, you can take 20% off of both the supplements that I'm going to mention, ultra potent vitamin C and zinc AG. The only thing is that these it's only good while supplies last, and you have to show proof of a receipt, either for the ebook or the paperback book, to be able to get this deal. You do not have to be a patient of Dr. Akey or Dr. Kathleen's, but if you would like to take advantage of these deals, you can email us at nfimgmv, as in Gators Make Victory, @gmail.com, or you can visit our FIRRIMupDoctors.com website. On here, you'll be able to have links that take you directly to the supplements, as well as a link to our paperback guidebook right here, which is going to be $29.99, or our ebook guidebook, which is available on Google Play for $9.99. Again, our website has all of this information, and you can always email us at nfimgmv@gmail.com, or you can give our office a call. Here's a little snippet of our online store, our website, FIRRIMupDoctors.com. If you go over to the shop tab, which is highlighted right here, it's going to have a list of all the places you can get to. And Get Healthy is our newest link that we have, which will give you access to pretty much every single supplement you could imagine. You can also purchase the ebook on this first link or on our homepage. So some more updates. With our new website coming in, we're actually doing a very short but pretty good sale on omegas, as they talked about in our FAQ for today. If you would like either of the following, you can go ahead and go to our website. I recommend you guys take a picture or write down the code down here at the bottom, FIRRIMup Omega. And you can go ahead and take 10% off for the following, starting tomorrow until July 11th, excuse me. And if you are vegetarian, I should say, we also have another supplement that's the same exact thing, but in vegan form, and it's going to be Algae Omega. Again, you can take 10% off, but instead you're going to use FIRRIM Algae, and you can get the same discount, same pricing for all of that on the website, FIRRIMupDoctors.com. There'll, again, you go to the link of the shop tab, Get Healthy, and you will be able to find all this information by searching it. On the website, there's a very good description of everything, as well as the supplement facts. And again, always, if you have any questions, email nfimgmb@gmail.com or FIRRIMupDoctors@gmail.com. And you can always call us for more information. And one more exciting news. So after speaking to both doctors and doing our survey, we decided to change our date that we do our webinars from Fridays to now Thursdays. This was, again, a lot of the feedback we got from most of you that completed our survey, as well as something that works better with both doctor schedules. So now we are going to be switching to Thursdays from 3 to 3:30. This will be starting next week, so we will no longer be on a Friday. When we go ahead and update our Zoom link, it will automatically send out an email to everyone. You won't have to re-register or anything like that. You'll already be set, but you will get an email that says some changes have been made, and it'll give the date and the time. We will also probably be posting on our Facebook page as well as in our weekly newsletter that we send out. We will have all these changes. If this works better for you, great. If not, it is always recorded and you can always head back to Facebook or our YouTube page to watch it later on. As I said before, any questions, you're always welcome to email us. We try to get back in a very timely manner. If you would like to head over to Facebook and ask questions, we also try to reply on there pretty quickly, either in the chat or through comments on our posts. Always trying to reach out whenever possible. So any questions, don't hesitate to call or to send us an email or chat, anything like that. We would love to help you. But I'd love to thank you all for joining us today on this holiday weekend. I hope everyone has a very safe and fun 4th of July, and we will see you next week on Thursday. Thank you.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.